I'd like to welcome everybody to our Thursday community call. Again, this call is recorded. If you do have questions for us, we would ask that you email to covid19@saukcountywi.gov. That's covid19@saukcountywi.gov. I'd also like to thank individuals that took part in our Thursday night call last week. We had 3 medical doctors from the 3 hospitals and our public health staff. And it was really a great presentation related to vaccine. I highly encourage you, if you have questions related to vaccine, that is on our website. The presentation was recorded and you can gladly watch that. Also, we got a lot of questions beforehand and during the presentation last Thursday. We were unable to get to all of them. So today, Jesse Phelan will be answering some of those. There were a few that we weren't able to answer and have been sent out to medical doctors for their answer, and we're still awaiting those. So with that being said, I will turn it over to Jesse Phelan to address what she's going to talk about.
Thanks, Jeff. Just an update here with our disease investigation and contact tracing process. Because we have seen a bit of a decrease in cases, Sauk County Public Health is now able to contact 100% of our positive cases. And we are also able to resume contact tracing as well. So what you may notice is you may get a call from the state of Wisconsin contact tracing team. At the health department here, we will be calling the positive cases, getting lists of contacts as we did in the beginning when COVID started. And then we will be sending those contacts down to the state contact tracing team, and they will reach out to the folks who've been in contact with somebody who has COVID-19. Household contacts, so those who live in your household, if you test positive, we will be the ones following up on those. But anyone else outside your home may be contacted by the state contact tracing team. And now we will turn it over to Jody for some testing updates.
Okay, thank you very much, Jesse. So you'll see on your screen that we have testing available throughout Sauk County most days of the week. Also, I wanted to remind everybody of some of the ins and outs on our testing because of the fact that we have seen lower rates of testing. And just a reminder that it is very important that our community continues to get tested so that we are able to quarantine and isolate those with positive results. So we can test anyone age 1 and older at our Sauk County free community testing sites. The tests that we conduct are molecular tests, or also known as PCR tests. These tests are not the antibody tests, so they won't tell you if you've previously had COVID. We do recommend testing for anyone that has COVID-19 symptoms, anyone that has had close contact with someone who is a positive case, and anyone that has regular exposure to many people, such as people that work in grocery stores or restaurants. If you are getting tested because you're concerned that you have been exposed, we do ask you to wait 6 to 7 days after the possible exposure, because that's the perfect window for when to get tested. Unless, of course, you are experiencing symptoms, then you can get tested right away. We do not recommend testing for anyone that wants to make sure they're okay. Testing will only tell you if you've had COVID on the day that you were tested. A negative test does not necessarily mean it's safe to gather with people, because it can take up to 14 days after your exposure to develop your symptoms. So you could be infectious a few days after a negative test. The best way to reduce your risk of getting and spreading COVID is to avoid gathering with people you do not live with. People who want to get tested regularly for peace of mind, we also do not recommend that. This is due to the fact that tests are in limited supply, and we do need to save our testing resources for symptomatic people, those who have been in close contact with cases, those who are regularly exposed to many people, and of course, those who work with our high-risk populations. So again, testing is just one of the great tools that we have in our toolkit to help stop the spread of COVID in our community. I will turn it back now to Jesse.
Just a little information, as I know everybody's anxious to know about vaccinations. So right now, the State of Wisconsin COVID-19 Vaccine Program Advisory Committee on Immunization Practices and the Wisconsin State Medical Advisory Committee as also known as SDMAC, as you'll hear us refer to this group, has provided guidance about priority groups for vaccination until there is enough vaccine for everybody who wants a vaccine. So as you can see on the screen here, the current eligible populations, which was formerly known as Phase 1A, are frontline healthcare personnel, residents and staff of long-term care facility, police, fire, and correctional staff, and now new this week, those age 65 and older. As you can see, starting about March 1st, that date is kind of tentative at this point. Other folks will be added in, and we are not sure what order at this point, but they will be educators and childcare, those enrolled in Medicaid long-term care programs, some public-facing workers, and then other non-frontline healthcare essential personnel, and then facility and staff of those working or living in a congregate setting. So more information to come as we learn it, but that is what we know at this time. So if you are age 65 or older, we do encourage you to attempt to get your vaccination at your medical home or your provider's office, whatever you want to call that. So because they're taking so many calls, we're encouraging you to first check the website of your medical provider to see what the specifics are. And many of them will have a process on their website, but also our website here at Sauk County Health Department has our vaccine site locator map, much like our testing site locator. So you can click on any of these little green dots and they will tell you the details that you need to know about each and every one of those locations and the instructions, whether it's to call or to sign up, or if they have a link, it will be there for you. So please keep an eye on that because we are adding more places as they become approved vaccinators. And again, just a reminder about how to keep up to date. Sign up for the Nixle alerts. Instructions are on your screen. Keep checking on our vaccination page. Links are there as well. And then we also keep you updated on our Facebook and Instagram pages as well. So keep an eye on those and we will get changes on there as quickly as we can.
Thank you for those vaccine updates, Jessie. Next, we're going to move into the Q&A session of today's call. And just a reminder that if you have any COVID-19 questions, to please email them to covid19@saukcountywi.gov, and we might answer them on an upcoming video. And for today, our questions are from last week's COVID-19 vaccine press conference. So these are the questions that we ran out of time to answer during the call. And we will answer all the ones that we are able to. As Jeff mentioned, there are a couple of questions that were sent off to some of our medical professionals, and we're waiting for responses for those. So we'll update you on them as well in future calls. Okay, and the first question that we received was, what advice do you have for people to recognize and avoid misinformation about the COVID vaccines?
So as you can see, Siobhan put several very good links on there. Making sure you're getting your information from reputable sources. So anything you see listed here will have good, up-to-date science and evidence-based information listed for you. They include Wisconsin Department of Health Services, the CDC, and then of course our website as well.
Our next question is, when will people under the age of 65 with underlying medical conditions be eligible for the COVID-19 vaccine?
We aren't sure yet, so we encourage you to continue to check back to the resources we provided on the previous page or our website. As we get that information, we will relay it to you as soon as we know it.
All right, thank you. And our next question, so many of the announcements made so far have suggested that people contact their primary care provider for vaccination. What should people without a regular healthcare provider or those who are between providers do?
That's a great question. So all of our healthcare systems in Sauk County have indicated to us that they are still taking new patients for vaccinations. So you could reach out to the one that's closest to you. Other vaccination sites, such as local pharmacies, are also listed on the Sauk County Vaccination Site Locator, and those may work out for you as well.
Another common question that we get is, can people without health insurance get the vaccine? And if so, what would it cost?
Yes, people without insurance are able to be vaccinated at no out-of-pocket cost to you.
And the next question is, where can I find more county data on vaccination? And I'll handle this one today, Jesse. I have put on the Data Hub a vaccination data page, and right now that is updated every week on Wednesdays, and it shows the number of Sauk County residents that have received the first dose of vaccine and the number of Sauk County residents that have received the second dose of vaccine by day. So that information is available for you there. And for our last, more of a comment than a question, but we are all hearing and we all share in the frustrations that the vaccine rollout process seems to be taking a really long time. Why is that?
Yes, and we definitely understand that frustration, and we want everybody to be vaccinated as quickly as possible. But how much vaccine each site receives per week from the state depends on many factors: the supply the state has, the capacity of each vaccinator, and the population that the vaccinator serves. Agencies are giving as many vaccines as they can. Sauk County Public Health has also partnered with the National Guard to get as much vaccine distributed as possible.
Thank you so much, Jesse, for answering all of those questions. And next, we will move on to our Sauk County COVID data update. So give me just a moment here to swap our screens. Okay, now we are over to the Data Hub. And to give an update, as of today, January 28th, there have been 5,041 confirmed COVID cases in Sauk County. There are currently 165 active cases, and there have been 192 confirmed cases ever hospitalized. For probable cases, the current number right now is 233. A quick note about our probable cases is that you may see this number fluctuate up and down on a daily basis. And this is because occasionally a probable case will have a follow-up PCR test that will come back positive. And so that probable case will then become a confirmed case. So if you see on the daily data updates that number being a -1 or a -2, it's because of those probable cases becoming confirmed cases. So it's expected that that number may fluctuate over time. Okay, so next we can look at our new cases by day and the 7-day average. So you can see that this green line is continuing to move down. However, when you look at the most recent week, so the most recent 7-day period, especially when we compare from last week's update video on the 21st, so you can hover over and see here. Let's get to the correct day. So last week on the 21st, the 7-day average was 15 cases per day, and that has gone up slightly to today. That average is 17 cases per day. So it's not a big jump by any means. Over the 14-day period, it hasn't been a significant change in the new cases per day, but it's not dipping us down below this line here for us to leave that very high case activity level. So we would like to see this going more downwards so that we can get below and out of the very high case burden. And ultimately, where we really want to be is actually below this line here so that we can get into the yellow and be in a medium case activity level. So we still have some work to do there to continue to stop the spread of COVID in our county. We will then pop over now to our 14-day COVID data trends. And there have been a couple of changes in the status of some of our metrics since last week. So the most notable of which is that for the first time since early September, our lab timeliness is in the green. And then the other change is in our influenza-like activity. So this had been in the red. We'd had an elevated influenza-like activity in our emergency departments for the past 2 reports. So seeing this move to the green is also a good sign. So we'll do a quick little run through of our 14-day data for you. Again, for this disease activity dashboard, if you go under the select area to Sauk County, it will then populate this with Sauk County's data. And you can also click on these case activity indicators to change it from case activity to percent positivity COVID-like illness and the influenza-like illness activities. So we will go ahead and start with the case activity level. We are remaining in a very high case activity. Again, not a significant change over the past 14 days. We're staying kind of steady with our cases. And one change that they did make to this dashboard, so this is a state data dashboard, is the ability to see the activity data over time. So if you click that magnifying glass, it'll shift the view here, and you can see how our case activity had increased in mid-November and then has continued a downward trend line since then. So you can see additional information that way. The next information to look at is our percent positivity. And you can see that in the last 7 days, our percent positivity has been 5.9%. I do also calculate this out to be 14 days to be more consistent with all of the other metrics. So over the last 14 days, that percent positivity is 5%, which almost puts us to the green, but not quite. So it has to be 4.9% to get us into the green level. So hopefully we can continue that downward trend in our percent positivity. However, when you look at it here, you would see the most recent couple of days has unfortunately been an increasing percent positivity. So we'll continue to monitor that and kind of see where we're at there. But hopefully we can get that also moving back down in the correct direction. And then our COVID-like illness is staying pretty steady. That has been in the moderate burden level with a not significant change now for quite a few weeks. So it's remaining us in the medium or the yellow zone. And then our influenza-like activity is now down into the green with a low activity level because 0.6% of our emergency department visits in the last 14 days then puts us back to that kind of normal range. So we're in the green there. So some of the other metrics that we track is the number of tests conducted. So we have continued to do above our baseline amount of testing. However, the amount of testing that we're conducting is continuing to decrease from where we were. So in the last 14 days, we averaged 330 tests a day. Last week's report, that was 353 tests a day. So it is dipping slightly. To compare, back in November, we were averaging 510 tests a day. So when you mix the level of testing going down from where we were, along with our percent positivity remaining in the yellow and our community spread remaining in the yellow, indicates that we may not be testing and identifying all of the confirmed cases, all the positive cases in our community, so that there are then cases out in Sauk County that we don't know about. So a reminder again here that if you have any COVID-like symptoms, or if you have been exposed or think you may have been exposed, to please go on and get tested. Next, our timeliness of lab reporting. So as I mentioned before, this has improved and is now in the green. So we did get 86% of our positive test results received within 48 hours of that test being collected in the last 14 days. So that's good news that our lab timeliness is improving. The next metric is our timeliness of disease investigation, and this has remained in the yellow for a couple of reporting periods now. And as Jesse had mentioned, we are, with the decrease in new cases, able to increase our capacity, so we're able to contact more of those cases to perform disease investigation interviews. So a reminder here that if you were tested by your medical provider may be contacting you with your test results, but public health will also be contacting you. So please answer that call so that we can begin the disease investigation interview process. And during this process as well, we're able to offer some additional support and resources in helping individuals who have COVID to be supported through that isolation process. So it's beneficial for you to answer that call and speak to our friendly disease investigation staff. And then the last metric that we track is our community spread, which is remaining steady the past couple of reports at about that 25%. So we have about a quarter of our cases that don't know where they could have gotten COVID. They're not linked to a known case. So next, as a reminder, there is additional data on the Data Hub. So there is also the confirmed case demographic data. So if you want more information about the ages of cases, the race and ethnicity, if you want the information about the severity of cases, that information is all available here. So you can view it there. And then there is also additional demographic data about the probable cases as well. So you can see the ages of them also on this page here. And then the last bit of data to go over is the vaccination data. And so that is on the page here. And you can then see on this chart the number of Sauk County residents that have received the first dose of vaccine and the second dose of vaccine by date. And this information gets updated weekly on Wednesdays. So you can see that so far, just over 3,800 people have received the first dose and just over 700 have received the second dose. So if you have any questions about the data, you can email covid19@saukcountywi.gov, and we'll be happy to answer that for you, and we may even feature your question on an upcoming update vlog. Thank you, everybody. Stay safe, stay healthy.